Well, breathing issues are causing some discomfort on the San Diego health front right now, and the nurse practitioners at CVS Minute Clinic say the sources range from viral to bacterial to environmental. Here's this week's What's Going Around report. In North San Diego, Trina Acosta-Teson in Escondido has seen patients with viral sinusitis. This usually develops after a bout with a virus like the common cold. Symptoms include nasal discharge, headache, facial pain, fever, and a cough. The focus of treatment is keeping the sinuses clear. That may include saline nasal rinse, over-the-counter decongestants, cough suppressants, and nasal steroid spray. In East San Diego, more breathing issues. Amy Polizzi in Santee says that some of her patients are dealing with acute bronchitis. This is an inflammation of the main airways to the lungs. Symptoms include chest congestion or tightness, a cough, shortness of breath, wheezing, and a sore throat. The cause is usually viral, and treatment may include lots of rest, plenty of fluids, and over-the-counter cough suppressants. And that trend continues in central San Diego, where Lori Glicklich in Mission Valley has diagnosed a few cases of community-acquired pneumonia. This is an infection of the lungs that does not develop in a hospital setting. Symptoms include a cough, fever, shortness of breath, fatigue, and difficulty breathing. This infection can be very serious, even require hospitalization. So if you think you may have it, see your healthcare provider immediately. And in South San Diego, Kasia Lalacata in Chula Vista has seen some cases of gout. This is a form of inflammatory arthritis often caused by a high consumption of meat, poultry, or seafood. Symptoms may include pain, tenderness, swelling, and a limited range of motion. Treatment includes diet, weight loss, and prescribed medication. And that does it for this week's What's Going Around.